what we'll do is go straight into the Q&A. So how we'll do this, you can either message it into the chat box, or you can just unmute yourself and ask a question directly. Does anybody want to go first?
I'll go first. Oh.
Okay, Zaid?
Yeah, so both you guys touched on COVID and the impact that it'll have on dentistry. What impact do you think it'll have in like the coming weeks, months, and years, if it will have an impact?
Yeah, who would like to take that one?
Yeah, I mean, I'll have a go at this one. Yeah, it's a very good question. Very good question. Now, a lot of things have changed, primarily in how we manage patients. Before COVID, I used to see like 30 to 40 patients a day, very busy diaries. I also work in a mixed practice, so NHS and private. I'd say we have sort of a moderate NHS contract. So it's probably going to be, for me, half and half in terms of NHS patients and private patients. Since COVID, we see far less patients. Things have changed in terms of infection control. Now, we all know infection control is very big already in dentistry, even before COVID, but now it's even bigger. There's a lot of protocols. So at the moment, we're seeing a lot less patients. It means you can spend longer with your patients. Moving forward, I'm not sure what exactly is going to happen with regards to NHS dentistry. So I can't really give you too much information on that. But I feel like I have heard rumors. I'm not sure if you guys are aware of, obviously, the NHS contracts, but it was the UDA system, but it could move back into the fee per item, which is what it was. I think it was prior to 2006, the fee per item, which obviously there's pros and cons to both systems in terms of NHS payment, but we're not sure what's going to happen with regards to that. But yeah, I think COVID will change the way we do dentistry. We do wear these really big masks now. It's quite hard to keep them on for long periods of time. And obviously until sort of we have a vaccination, it's indefinite as to how long we'd be having to wear all this PPE and keep exposure to a minimum. So it's taken a few weeks to settle in, but we have settled in. We have sort of found our rhythm. And yeah, we just keep moving forward with it at the moment.
Next question.
I was just going to add a little bit more to that, if you don't mind. I was just going to say, COVID has kind of brought the perfect opportunity for more digital dentistry in terms of scanners for Invisalign. There are practices out there, for example, mine, that use scanners, and those scanners can also be used as part of a patient examination. So I think with the way things are going, long term, you will find that there might be a bigger push for more digital dentistry if it means that there's less invasiveness in terms of what we're actually doing with our patients. Anything to limit the potential spread. I think, like Aunkit said, in terms of infection control, it's something that's pretty well managed at the moment anyway. But what I've noticed is that right now it's at its peak, where there are so many precautions. I'm hoping it will settle back down a little bit more. We don't have to wear the big masks for too long, but even afterwards, it will still be quite important, or even more important than pre-COVID. And also, funny enough, I'd heard that the NHS contracts, rather than going back to the fee per item, maybe it would be the right opportunity to bring in the new contract, which was planned in terms of recapitulation. And so that would be more in terms of the traffic light system of assessing patient risk and seeing what is safe or appropriate for a patient based on their level of oral hygiene and other risk factors. So even between this group, we have different viewpoints as to what the future holds. So nobody really knows as of yet. But I think it's good to kind of know past of the history of dentistry and what the future holds. And if you're able to at least discuss both, then you should be fine in terms of answering potential questions regarding that.
So we've got a question from Andre, how difficult is it to get a private job, and what are the pros and cons of being private, mixed, and NHS? So this is something that came up in the last virtual work experience. Actually, we'll start off with Dr. Toyin. If you just briefly tell us what being private means as a dentist, and then go into the question of how difficult is it to get a job as well.
Okay, so with private dentistry, the criteria, the rules that govern the NHS patients is completely different. So, and I think that's even become more apparent during this whole COVID crisis, because with private dentistry, you essentially are charging patients for everything based on a fee. So rather than with the NHS system where the patients are charged based on banding, so band 1, band 2, band 3, patients are charged for everything individually. So whether it's an examination or filling or even a general clean, those are all separate items, fee per items as such, and you're charged for it. With private practice, there tends to be, I would say, more time potentially, it depends on the practice, more time for discussion and really forming a relationship with the patient, because rather than, let's say, an NHS 15-minute appointment, you might have half an hour, or depending on the practice, even longer. And in terms of the difference in materials, for example, you might find with NHS, you might, for fillings, opt for, well, even with the amalgam, that's changing already within the NHS. But let's say you have a 40-year-old male who comes in as an NHS patient, you will be offering him, as an NHS, silver amalgam fillings. You're unlikely to offer him with the white composite filling under the NHS, because the main thing about NHS treatment is it has to be deemed appropriate and functional. It does not have to be aesthetically pleasing. That's not part of the criteria to be fulfilled. Whereas with cosmetic dentistry, private dentistry, it's more based on whatever the patient wants, essentially. So that same patient, if he went to a private practice, he would most likely be offered a composite filling, a white filling. He might be offered a silver amalgam filling, but even that is a separate charge. So I think that's the main differences I can think of within private dentistry versus NHS. I think actually there's probably a lot more options outside of NHS in terms of different materials, and how you have the treatment can vary as well.
Yeah. How hard is it to get a job as a private dentist?
That's a really good question. I would say it's probably more challenging to get a job in private dentistry than as NHS, because of the fact that the criteria to meet, being that more people are looking to, they might find the idea of working in a private practice more appealing. They think it's going to be more lucrative. It might be more difficult to get a job. I know when I've looked at the criteria for private dentistry jobs, they tend to want postgraduate training and qualifications. And I can completely understand this, because these patients are wanting high-end cosmetic treatment, and with private patients, they're willing to pay the value, they're willing to pay the costs involved. And so the practice owners, they want staff, dentists that are well experienced, they've done lots of postgraduate courses, they've probably got a portfolio, a camera, loops, all these things, so that they know that their patients are going to get the best value for their money by being treated by them. Whereas with the NHS practice, the criteria might be different. Yes, they might want a certain number of years of experience, but they might not be asking for all those other things, because their main priority is, can you fulfill NHS UDAs? Are you going to be efficient, as well as working, treating patients well? But I think what they're looking for is different. And I've been quite fortunate in terms of, I think the hospital experience that I had allowed me to get a good footing. Technically, I'm still in an NHS practice, but the practice itself is well established and it's predominantly private patients they see. So if I was to now apply for a job in a private practice, I'd be confident that I'd get it. But I think if I hadn't had a strong portfolio, it would have been more challenging. And if you're thinking private dentistry long term, then from the very beginning, I would say be strategic about the jobs that you apply for, the courses that you go on, the people that you meet, because as of dentistry, like most professions, who you know does help to some extent. So it's just one of those things really, but it's all possible as long as you're smart about it.
So, the next question, we'll get Dr. Aunkit to answer this. What is the difference in job roles for someone who has studied dental hygiene and therapy compared to someone who has studied dentistry? It's a good question.
Very good question. Yeah. Okay, so yeah, we did have in our practice a therapist. So different to a hygienist, they can do sort of a few more things. Obviously, when it comes to dentistry, you can do everything. Hygiene and therapy is predominantly going to be, you can do sort of basic fillings. Obviously, a lot of perio, so cleaning, gum treatment, etc. When it comes to more advanced things, obviously such as root canal treatments, crowns and bridges, that can't be done by someone that's done dental hygiene and therapy. So you're all limited in sort of what you can do. But obviously, I know some people that maybe haven't been able to get into dentistry may seek to go for the dental hygiene and therapy option because they really want to just, get into the field. So yeah, it's maybe more like a sort of more of a skeleton dentistry type. It's not as, you can't do everything, but it's a bit more limited. But you're still managing patients. You still have your own diaries the same way. A lot of the sort of treatment done by a therapist is usually referred to from a general dentist. So I may refer some patients to my therapist to do some basic fillings or some periodontal treatment. And that's sort of how the sort of process works between the professions in a practice.
So can you just talk us through, if I was a patient, how that would all look? I see you, what would happen next in me seeing you and the therapist?
Yes, obviously, you need to ensure you tell the patient that if they're coming back for treatment, what treatment they need. So say if you were coming back to have some periodontal cleaning for your gums, then I would probably send that to the therapist. So I will tell the patient that, I've seen you today, I've done your check. You're required to come back for a clean. I'm going to book you in with our therapist who works specifically on this kind of treatment. She can spend a bit more time with you and give you advice. So you tell them why you're going to send it to someone else, because they'll probably say, why can't you do the treatment? So you want to inform them that obviously the person that will see them is probably better equipped. Maybe you don't phrase it like they're better equipped. You phrase it as though like they're going to spend more time with them, and they can obviously focus on specific things that will help the patient. And they'll understand that. Most patients will understand that that they're going to be seeing someone else. I think usually in the patient's mind, they're not really familiar with the term therapist. They'll just assume that they're going to a hygienist, but obviously a therapist is different in that they can do a few more things compared to a dental hygienist.
Okay. Next question. So we'll aim this towards Dr. Toyin. What did you think about pediatric dentistry compared with other specialities?
Could you repeat? I think I got most of the question, but my internet went a bit funny there.
What did you think about pediatric dentistry compared with other specialties?
I would say I still really enjoyed it. I think it requires a certain skill set. Within pediatric dentistry, you're dealing with essentially little people. But in terms of that, you're not only managing the children, you're managing the parents. And the parents tend to be more challenging than the children, because you're dealing with anxious parents who are very concerned about their children, but also they may not always accept responsibility for the fact that their children might have lots of decay. Pediatric dentistry, some people go into that field for hospital training because they feel like they want to really know how to deal with children and know how to manage the treatment accordingly. I did enjoy it. I wouldn't say it's my absolute favourite, even though I do love working with children and seeing children in general practice. I think in the hospital, it's quite different. But the good thing about the hospital side of the pediatric dentistry is that you're always well supported. In terms of the setup, you're the dentist, there's a nurse, but then there's lots of people, there's consultants and registrars, which are people training to be specialists who are most likely going to be supervising the treatment that you do. So I think pediatric dentistry from the training point of view is really, really good, and you'll be confident in dealing with children and the complexities that come with that. In terms of doing it as a career compared to other specialties, I think it's quite rewarding. I don't think it's for everyone. I think you have to have a certain, almost you must like children, and that sounds pretty obvious, but you would struggle to find the patience and the personality to really work well with children if that's something that you're not particularly excited about. So for me, as much as I enjoy it, I think working with children all day wouldn't be for me, just because I like the variety of dealing with adults as well as children. But for some people, it's the perfect combination of all the skills that they have.
Awesome. Somebody's asked, for the personal statement, would you recommend writing about an article or articles on dentistry, like a summary of it? Who would like to have a go at this one?
Yeah, I'll say a few words. On my personal statement, I did mention a couple of articles. So I just mentioned like the title of them. I think one was to do with technology, and I think the other one was to do with the aging population, which was quite a big thing back in, well, it still is a big thing, but it was quite a big thing when I was applying. So obviously to do with the fact that given our aging population, dentistry is changing in that we have to manage the aging population. We have to make a lot more dentures for them. And there were sort of queries about possibly making a full dentures could become, in its own right, a sort of a specialty. So I did mention a couple of articles in my personal statement. I'm not sure if I would actually write a summary on those articles, because your personal statement obviously is quite limited. I can't remember what it was, maybe 1,000 words or something, but those 1,000 words, every single word is going to be so valuable. So you don't want to sort of waste it on writing a summary of something that isn't really yours. It's just something you've read. So you could briefly mention that you've maybe read an article. It'll probably, mostly of the stuff now will probably be heading towards digital dentistry, as Toyin said, and also towards post-COVID dentistry. So those are the two areas I would probably look into. And you could maybe mention that and just say that, you've had a read through these articles and these were the titles. And then they will probably make a note of that at your interview and they will pick up on it and then they will ask you. So certainly write a summary, but not for your personal statement, just a summary for you to obviously just learn, so you can sort of recite it to them when they do ask about it at your interview.
That's really good. So the next question I'm going to ask to Dr. Toyin, it's going to be on challenges. Andre, you asked about orthodontics. Can you just specify, are you talking about training to be an orthodontist, or are you saying is it quite expensive to, is it as a patient or as a dentist training to become an orthodontist? Just clarify for us there, and Dr. Aunkit will answer that one. So Dr. Toyin, what were the biggest challenges you faced when you qualified, and what challenges do you think we'll face in 5 years' time?
That's a good question. The biggest challenge, I think that's a difficult question for me to answer, only because I found that my challenges were in dental school. And that was just because it was a different environment to what I was used to coming from my background in terms of secondary school and so forth. But for the most part of it, I was so surprised as to how enjoyable dentistry was. Coming out of a dental school environment where it's learning, I just suddenly found myself in an environment where I'm doing what felt natural to me, which is treating patients, relating to patients. So in terms of challenges, I think the biggest challenge for me has been deciding what to specialize in, what to do. It's even now I'm still struggling in terms of with what's happened with COVID. Initially, I was very much of the thought that, yes, I want to own my own practice. I love that idea of being independent and being able to, manage a team and still be in charge without actually being in the building and just having that flexibility and time. And now COVID has come and I'm really thinking, do I want to own my own practice, or am I happy being an associate? And I think because I'm still early on in my career and I've been fortunate enough to explore a lot of different avenues within dentistry and finding that I enjoy a lot of it, the challenge is deciding what to focus on. At some point I will have to make a decision, and I think now I'm narrowing it down towards, yes, definitely general practice. I love cosmetic dentistry and general dentistry as well. So I think that question, you might find that different dentists have different answers, but I think I'm one of those super positive people, and I genuinely don't think I've had many challenges following qualifying. I know I can speak broadly and say that some people find it difficult to manage the work-life balance in terms of there is a lot of work. A lot. And if you're not someone that's efficient and focused, you might find that you become overwhelmed with that amount of paperwork. So time management and organizational skills are really key to being able to manage your time within the general practice setting. You don't want to be staying in the practice till 9 o'clock still writing notes. So if you're able to manage your time well within the time you're working, you will find that you will get the right work-life balance, and that in itself makes dentistry a lot more rewarding. Yeah.
Fantastic. Dr. Aunkit, that's plenty of time to answer the question on orthodontics now.
Right, I'll try my best. Now, I did consider orthodontics. Andre, obviously, you're saying that it's quite expensive to do going to university, and you're right. When you do come out of dental school and you do want to specialize, there's two ways you can do it. Now, I think, correct me if I'm wrong, Arnold, I'm trying to remember because obviously I have not considered specializing, but there's two pathways. You can go via university and you can go do masters in restorative orthodontics, any of the specialties. You can do a masters if a university is offering the masters, and obviously you pay for that. The other pathway is when we spoke about the hospital posts that we've done, the DCT posts. So you apply for these DCT posts and you go and do your training in the hospital. Obviously you're getting paid for that, but those DCT posts, then you can apply for the registrar pathway. So that's again via the hospitals. And the registrar pathway is you have like, I think it's for oral surgery, it's like 3 years. I think orthodontics might be maybe 5 years, I'm not sure. But that's the other pathway where you go and do your specialty training via a hospital, and you get paid a salary, but you're basically working with consultants there, and you go through the registrar pathway. So you're not paying for that. That's that you've managed to get on that pathway, and you're being paid to do that hospital pathway. Now that obviously is very, very competitive. When it comes to orthodontics, There was a person at my university. There was only one guy in my year that did get on that pathway via the hospital. And he was the guy that got the awards for all the dental school awards. So he was very, very smart, and he got on that pathway. But for those people that can't get on that pathway, you can obviously pay to do that. So you pay the universities that offer these specialty masters training, and you can do it that way. So that's the two ways you can do it. So yeah, it's expensive to do if you're going to go via the university, but obviously if you're lucky enough to get on the hospital pathway, you know, then obviously you don't pay for that, but it's a lot of hard work, and you can sort of become an orthodontic specialist both ways. Okay.
Thank you. And that's the amazing thing about being a dentist as well, being a general dentist, is that you get exposed to different areas of dentistry. So once you become a dentist, you don't have to rush into specializing. You can still experience different areas of dentistry. And let's say you like orthodontics, you can do more of that as a general dentist. You can go on courses to enhance your skills in orthodontics as a general dentist, so that you're seeing more patients for that type of treatment. And if you love it to the point that you don't want to do any other treatment, you can then choose to specialize. So it's not a race. You can still get into it bit by bit and then fully commit once you're sure. So that's the great thing about being a dentist. You get the options and it's all open to you. We'll use this as the last question. This will be to everybody. What keeps you interested in the dental field? Aunkit, what keeps you interested?
I think for me is more so recently, you know, going on courses. So I did a year-long course last year. So there's a really, really famous dentist called Monique Vasant. He does all the composite courses, and he's got a year-long course that he established a couple of years ago. So that was based in London. So I would travel down to London 1 day a month, and he would focus on all things aesthetic dentistry, photography, composites, veneers, bridges, crowns, just everything. And it just refreshes you. He goes in a lot of detail, so there's a lot to learn from these courses. But that's what helps me sort of keep my dentistry refreshed, keep it modern. And nowadays, this is what patient wants. They want to discuss how to improve the appearance of your teeth. So, and the other thing is, on these courses, you get to meet people. I think meeting other dentists, talking to other dentists. I've known Arnold now for a bit now, and it's nice discussing with him how he manages patients, and it gives me ideas, and I'm sure he learns as well. So we just sort of bounce off each other. And I think when you interact with other dentists and you learn how they do things, because there's a million and one ways to do the same thing in dentistry. There's so many materials out there. There's so much equipment out there. Technology is just constantly increasing. And knowing that there's different ways to do things, and how you can maybe improve yourself, I think that's what sort of helps me. I also enjoy going to the conferences. If there's a conference in London, I'm the first one to sign up, because I love going down south. I have a lot of dentist friends down south. I don't want to work there. I'm not too keen on the lifestyle down there. I prefer staying up north in Preston. But it's just going to these sort of conferences and seminars. It just keeps my CPD up, which is the continual professional development hours that we have to do. And it's just nice meeting other people. So yeah, as long as you just sort of stay active, you don't want to just be going into work home, because that's not going to help you. You want to make sure you sort of interacting with other people. In my practice, every month we hold a dentist circle meeting, which is based in Bolton. So all the dentists from our various practices meet up in Bolton, and we all share ideas. We share cases. We have basically a study circle. So it's a bit like university, a bit like being at uni, but it's a lot more fun, and we make it quite interactive.
Awesome. And I think for the next 2 or 3 minutes, Dr. Toyin, if you tell us what keeps you interested in dentistry.
I would say similar to Aunkit, it's definitely the courses and it's that idea of continuing to challenge myself to do the best for my patients. So I would say what drives me is this thought at the back of my mind is how can I best serve my patients? So that often leads me to either go on another course, or in my most recent decision was changing practices and signing up for a year-long cosmetic course, which I'll be starting in September. But also it's kind of made me want to do different things. So setting up a social media kind of campaign, so on Instagram and just various other things, to really find ways to not only meet new patients or patients can find me, but to put myself out there and connect with other dentists. I think things like that really just allow you to not just become a dentist that just works 9 to 5 in your general practice or hospital setting, wherever, but you actually get to interact and meet new people. And I think I've really enjoyed that during this lockdown period, because as much as you want to do the courses and stuff like that, there's been a bit of a slowing down with that, only because of COVID, but it hasn't really stopped dentists engaging with patients and meeting each other and connecting. And yeah, I think it's just that, really, just knowing that yes, you may be a dentist, but you know, you're a person, and you can not only within the profession, but with patients you can find different ways of meeting them. Now social media has just kind of completely changed the way patients see dentistry, and so now we're no longer the scary dentist, but you know, we're the person that can transform your smile. So I think the way dentistry is changing is motivating me more to put myself out there and to really just enjoy it. And I think the younger generation of dentists, where we're not only seen as just dentists, we're fun people, we're human beings, we're caring. And yeah, I think that's the kind of thing that drives me within dentistry at the moment. Yeah.
Okay, so thank you everyone for being attentive. Dr. Aunkit, Dr. Toyin, for being with us. Their precious time, giving it up to speak to us.